Okay, we've compiled a short video today to show you guys how to give medications regardless of the type or route for all medications. So first of all, what you're going to want to do is you're going to want to know the agency and facility policies, which is typically to give the medication either an hour before or an hour after. You have that 2-hour time frame to give the medication. Secondly, you're going to want to make sure that you know the medication information. So today we'll be giving heparin, and that is an anticoagulant and an antithrombotic. What we'll be giving it for is deep vein thrombosis prophylaxis. We're going to be giving 5,000 units subcutaneously, and we'll be giving it twice daily. And we're going to want to watch for adverse effects of fever, hemorrhage, or edema. So the next thing we're going to want to do is make sure that the dosage is appropriate for our patient. So our patient does not have any renal impairments, and he's of appropriate weight and age. So we would deem that this medication is appropriate to be given, and there are no special considerations for heparin. So now I would want to draw out the medication. And the first thing I want to do is look at the expiration date, and the expiration date is December of 2016, so it's appropriate to give this medication, and the condition, it's in good condition. So now what you want to do is calculate the dosage of your medication. So the order is for heparin, 5,000 units subcutaneously twice daily, and the conversion ratio on the bottle is 2,500 units per 0.5 milliliters. So we've got the calculation on the board here. So we're to give 5,000 units. Here's our conversion ratio of 0.5 milliliters per 2,500 units, and we get a total of 1 milliliter to be given. So then we're going to want to sterilize the vial for a total of 15 seconds. Okay. We'll want to draw out the appropriate syringe, and this is a tuberculin syringe. So now we will perform our first check. So our patient is Donald Bumper. We're giving heparin, so I'm verifying on the vial as well as the MAR that we're giving heparin. 5,000 units with the conversion ratio on the vial of 2,500 units per 0.5 milliliters. We're going to make sure it's the right route, which is subcutaneous with the right needle, and twice daily. So now I will uncap my needle, and I will set it on my alcohol pad to maintain sterility. I'm going to now draw up 1 milliliter of air that I will now inject into the vial while it is on a flat surface. After I've injected the air, I'll now invert the vial, draw up 1 milliliter of the medication, tap out any bubbles, and remove the needle at a 90-degree angle. Then I will recap my needle using the one-handed sterile technique. Okay, so now I will perform my second check. So I just want to make sure that I have the correct patient, which is Donald Bumper, and we'll verify that when we go into the patient room. The right medication is heparin on the vial and on the MAR, and it's 5,000 units. We've got 5,000 units with a conversion ratio of 2,500 units per 0.5 milliliters, given sub-Q in the tuberculin syringe, and twice daily. So now I would want to make sure that I lock my medication cart as I'm going to leave the room. I'm going to want to take the medication administration record and my needle and my vial into the patient room. Okay, so when I enter the patient room, I would want to make sure that I assess my patient for any current bleeding, and I would want to monitor the patient's blood counts and monitor him for any signs or symptoms of anemia, as we would not want to give this medication in those situations. Now I will perform my third check, so I want to verify that I have the correct patient. So could you please tell me your name and birthday?
Donald Bumper, birthday is October 17th, 1921.
Okay, so I have the right patient, and now I will want to check the medication. It's heparin. We have the right dosage. We're going to be giving it subcutaneously in the tuberculin syringe, and we will be giving it twice daily. So now that we have the right patient, we can go ahead and inject the medication. Okay, I will now want to throw my needle into a sharps container, if there's one in the patient room. I would want to make sure that I do not leave the medication unattended at the patient's bedside if this were an oral medication, and I would remain in the room until the patient had swallowed the medication. After the medication's been given, I would now reassess my patient for any bleeding, bruising, swelling, inflammation, redness, or difficulty breathing. I would then want to teach my patient that he is at an increased risk for bleeding and bruising. He's going to want to avoid taking any other NSAIDs such as aspirin or ibuprofen, and he would want to report any bleeding, bruising, dizziness, or rash to a healthcare provider. And he wants to avoid injury. He wants to use a soft bristled toothbrush and use an electric razor. And this concludes our